Bismillahirrahmanirrahim. Assalamu alaikum. Couple of months ago, my dear friends Dr. Muslim Atiq and Dr. Muhammad Saleh of Shifa International Hospital had kindly invited me to Islamabad to share my thoughts on compassionate care and counseling in GI and liver diseases with their esteemed team. Due to my busy schedule, I could not be physically present among them, which I truly regret. However, to honor that commitment and to remain connected with my dear friends, I have prepared this recorded lecture. I sincerely hope it conveys my message and adds value to clinical practice. Dear Dr. Muslim Atiq and Dr. Muhammad Saleh, thank you for your understanding, and I look forward to meeting you in person sometime soon, inshallah. Bismillah ar-Rahman ar-Rahim. Dear colleagues, when we talk about gastroenterology and hepatology, our minds often rush toward diagnostic algorithms, staging of fibrosis, and the latest interventional procedures. But let me ask you, what do our patients remember the most? Is it the dose of lactulose we prescribed, or the time we sat beside them, listened with empathy, and reassured them in their moment of fear? I want to share a small story with you. A middle-aged man with advanced cirrhosis was admitted under my care. He was jaundiced, had ascites, and his family was extremely worried. We started all the right medicines, did all the right procedures. Clinically, everything was as per protocol. But what struck me was when, during rounds, his daughter quietly said, "Dr. साहब, अब्बू आपसे बात करके ज्यादा बेहतर महसूस करते हैं दवाइयों से कम." "Doctor, my father feels better after talking to you than from the medicines." That one sentence reminded me that while pharmacology and procedures are essential, it is our compassion, presence, and counseling that truly heal the invisible wounds of fear, loneliness, and despair. This is what today's discussion is all about. Bridging the science of medicine with the art of empathy. Medicine cures the disease, but compassion heals the person. A prescription may save a liver, but empathy can save a life. Patients don't come to us only for treatment. They come to us for hope. Listening is often the most powerful intervention we can offer. In gastroenterology, we treat the gut and the liver, but never forget The heart must be part of the healing. Good doctors know the science. Great doctors practice compassion. Counseling is not an extra. It is an essential part of clinical care. Remember, counseling is not an extra. It is an essential part of clinical care. So today's session on compassionate care and counseling in GI and liver diseases is about revisiting that human side of medicine, the side that turns a case into a person, transforms despair into hope, and makes us not only better physicians, but better healers. Compassion care and counseling in GI liver diseases, it's bridging science with empathy, healing beyond prescriptions. And remember, good doctors cure, great doctors care. Why compassion matters? Patients remember how we made them feel, not just what we prescribed. GI and liver diseases often carry fear, stigma, and uncertainty. Compassion reduces anxiety, improves compliance, and strengthens trust. And empathy is therapeutic in itself, remember. The human side of GI and liver care. We know cirrhosis. In this condition, patients live with chronic fear of complications. In IBD, young patients face stigma, isolation, and depression. In cancer, families seek not only cure, but also comfort and dignity. And counseling is connecting, listening, and guiding. So our goal today is to understand the role of compassion in clinical practice, explore techniques for effective patient counseling, share stories, reflections, and practical approaches, and commit to being not just treaters of disease, but healers of people. When I searched the word compassion, I came across several different meanings. One, sympathetic pity and concern for the sufferings or misfortunes of others. Another meaning, a feeling of deep sympathy and sorrow for another who is stricken by misfortune, accompanied by a strong desire to alleviate the suffering. And another meaning, sympathetic consciousness of others' distress together with a desire to alleviate it. But the words that clicked for me were to suffer together. Poverty, mental illnesses, and evil actions cause hurt. It would be fair to say one of these hurts has affected us as well. Each day, we wake up and focus on ourselves and family. Do we think about those whom we encounter throughout the day? What about the neighbor 2 houses down? What about our co-worker? Do we think about them the way we should? Probably not. Compassion is defined as the feeling that arises when you are confronted with another's sufferings and feel motivated to relieve that suffering. Compassion consists of 3 facets: noticing, feeling, and responding. You notice somebody with some condition, you feel that suffering, and then you respond. So the compassion has got all these 3 components: noticing, feeling, and responding.